Hi everyone. I am going to talk to you today about a mystery bacteria that is in a patient's gastrointestinal tract. This is partly based off of my actual dog, Rome. This is Rome. Sorry, you can't see very well because of the computer screen. He was a 11-year-old male neutered plot hound when I adopted him in June of 2015. And he was dumped in rural West Virginia. He had, throughout his life, chronic problems with a severe sinus cavity infection that was secondary to severe dental disease. And when I adopted him, I had to take him to get every single tooth extracted. He also, as a result, had oronasal fistulas, like literally holes, like right here, which fed directly into his sinus cavity. He also had chronic problems with anal gland expression. Sorry, that was Gus. Anal gland expression. And he also had hookworms and whipworms. And he was successfully dewormed. Rome was totally up to date on all of his vaccinations and preventatives. He also received Lyme and influenza vaccines as well as just the normal core vaccines. So he was definitely up to date on everything. And this case study is based off of a bacteria that can grow in the small intestine and can let off enterotoxins into an animal system. So basically, Rome came into the clinic and he was completely normal, except that he was kind of quiet, but alert and responsive. His skin turgor was not normal. He was clearly dehydrated. When I did the skin tenting, the skin stayed up for a little bit. And he was drinking a lot of water, but not urinating more, according to the owner. And he was having, the original presenting complaint was severe diarrhea that had blood, mucus in it, and it was watery. So initially, the veterinarian ordered a CBC, which everything came back normal. A fecal float to check and see if there were any new parasites that had maybe infected his gastrointestinal tract, despite deworming, and there were none. And the doctor also ordered a direct fecal smear to test for protozoa. So you would see a motile trophozoite moving. So just covering all the bases with parasites, and nothing was found. So at this point, really weren't sure what was going on. I forgot to add, he had a painful abdomen. So basically what we have is dehydration, painful abdomen, and pretty severe diarrhea. So the doctor sent Rome and his owner home with metronidazole, a relatively low dose, 10 to 20 milligrams twice a day. And for his weight, he was 27.7 kilograms. And so his dose would have been 277 to 554 milligrams twice a day on the low end and the high end of the range. So Rome came back about 2 weeks later for his recheck, and the owner indicated that he was the same. Nothing had really changed. And so at that point, the doctor decided that because it wasn't parasites that we could easily identify in clinic, that a fecal sample should be taken and sent to a laboratory. And this time, the doctor would ask for bacterial culture, and if that bacterial culture was positive for certain bacteria, the doctor would then ask for an ELISA and an ELISA antigen test, along with polymerase chain reaction test, to definitively diagnose this particular bacteria. The bacteria would have to be isolated on a bacterial culture. And the isolation of strains on a bacterial culture would help in terms of providing isolates for a polymerase chain reaction test. So, unfortunately for Rome, the bacterial culture did identify this particular enterotoxin producing bacteria. And the technician was able to isolate these successfully. The fecal sample was suspended in a tube with broth and 96% ethanol. And then that suspension was then cultured onto a specific plate, a cycloserine cephozidin fructose agar. It was cultured anaerobically at 37 degrees Celsius for 72 hours. So, due to being able to isolate bacteria that seemed to fit the description, the next steps were specific tests to diagnose that specific bacteria. The gold standard for this one version, species of a bacteria, is to do an ELISA, which was positive, and then to do an antigen ELISA, which would test for the antigen that the toxin-producing bacteria would generate. And so the point of doing an ELISA, an antigen ELISA, is to confirm the presence of this bacteria in the gastrointestinal tract. Then, moving on from there, the antigen ELISA, in addition to confirming the presence of this bacteria, was also able to rule out another type of bacteria. So pretty much at this point, the doctor could have made a presumptive diagnosis. There's one more test that should be run to definitively diagnose this bacteria, and that was a polymerase chain reaction, which would test for the enterotoxin gene. And once that gene was identified, we would be able to then definitively diagnose this bacteria, as the bacteria would produce a specific enterotoxin gene. So unfortunately for Rome, the ELISA, ELISA antigen, and PCR were all positive. The doctor decided to do a gram stain in-house, and unfortunately the technician saw gram-positive anaerobic spore-forming bacillus, which fit the description of what this bacteria would look like on a gram stain. And so the doctor was able to definitively diagnose Rome with this bacteria and sent Rome home with metronidazole at a much higher dose. And so this dose was 44 milligrams per kilogram by mouth, an initial loading dose, followed by 22 milligrams per kilogram 4 times a day for 5 to 7 days. Rome then came back 3 months later for a recheck appointment, and another ELISA test was performed on a fecal sample to make sure that the bacteria was not present in Rome's gastrointestinal tract. And luckily for Rome, it wasn't. So the treatment was very efficacious, and even though it took an initial 2-week period to kind of rule out parasites and kind of realize that specific testing needed to be done for this bacteria, everything worked out and Rome was good to go. So hopefully you guys can try to figure out which bacteria it is. Just remember, spore-forming, bacilli shape, gram-positive, and it has that specific chain of testing, the bacterial culture, the ELISA, the antigen ELISA, and the PCR, in addition to the gram staining, is the specific path that needs to be followed for this specific species of bacteria. So hopefully you guys can figure it out. Thanks so much.